What up, guys? We are live on City Talk Show, and I'm here with
Bolaji.
Bolaji.
Hello, my friend.
Yeah, it's nice to have you on the show, man.
Yeah, thanks. I appreciate it.
Yes, man. So, can you please introduce yourself?
My name is Bolaji. Hello, my friend. I'm a medical doctor.
Okay. All right. So, how long have you been in this field?
Well, in the field as after medical school, because
Okay.
housemanship plus the rest. That's roughly 6 years.
6 years.
Yeah.
Wow. Okay. So, what do you find most interesting about your job?
Interesting. That's a tricky question. Well, anyway, so about interest, there are a lot of things that I actually find interesting in medicine, actually. And well, when you talk about patient-to-patient interaction, that's quite interesting.
Okay.
So other than that, the fact that patients can come into the hospital, you see them very sick, you see them almost dying, some of them, and at the end, you see them walking out both of with their feet. They're smiling, they're happy, the satisfaction that comes from that, it's undeniable. It's just, that's what you love from me. You see them all thankful. Some of them can decide to give this. Of course, our ethics don't allow us to take some things from patients and all that. But, you see the appreciation.
Sure.
So that's where the satisfaction comes from.
Wow.
Yeah.
That's nice. So, where do you see yourself in 5 to 10 years?
5 to 10 years. This question, it sounds like some of those date questions, right? Yes. When you go out on the days and someone asks, where do you see yourself in 5 to 10 years? Where do I see myself in 5 to 10 years? I don't know if I should be saying this on air, but anyway, I think most doctors, with this jackpot syndrome and everything, everybody eventually wants to leave because of the states of the country. Where I see myself in 5 to 10 years is actually not in Nigeria. If I'm going to be very honest, I see myself in a country like the UK is getting congested right now. But I will still go for UK, either UK or Canada. Some will pick Australia and the rest, but I see myself in UK or Canada with the love of my life. My family, of course.
Yes.
Then I see myself in my beautiful home, and then of course running my clinic.
Wow.
Yeah,
that's
right now.
That's amazing. That's amazing. So, what's your approach to dealing with upset or aggressive patients?
Okay, like when patient is angry. Patient is angry. Of course, sometimes patient tends to get angry with you and then they lash out. Some of them might just be annoyed at the kind of treatment they get. But that's where interpersonal skills come in place. We call it IPS. So you have to be able to calm the situation down, know how to talk as a doctor. I can't speak for the majority of Nigerian doctors. We don't know how they are, but I think when you're trying to relate to your patients, when you're trying to talk, especially to angry ones, tend to lower your voice, empathize, see it from the patient's angle, know what they are feeling, sort of try to feel it. That way you'll be able to curb the situation. And some of them can get very aggressive, but that's when you want to make a run for it. You don't want to be there while the patient is trying to rough handle you. You want to be far away from. We've seen a couple of cases whereby patients or the patient relatives beat up doctors, which is quite very sad.
Wow, that's
it happens a lot. It's not a strange concept. Some have happened even in my hospital.
This is the first time I'm hearing that, though.
It happens a lot.
Wow.
It's quite sad, and considering the jackpot syndrome now, most people are leaving, and the ones that are left, you're still beating them up. How strange it is. You shouldn't be doing that.
You shouldn't be doing that. No.
Anyway, when you are dealing with patients like that, you need to understand. The aggression. If the patient is coming to beat you, or you call their relatives, you want to flee, call the security or something. And then if it's something you can diffuse by yourself, maybe talk calmly to the patient, try to reassure them, and stuff like that. You can't do that. But my own personal approach is just to empathize with patients, relate with them, let them know that okay, there's a way forward. There's always a way forward.
Yeah, sure.
What you can do to help the situation. So that's my own personal approach.
That's a very nice approach though.